The intensive care in the clinic is divided up into 3 phases. First is the mobility phase, second is the adjusting phase, and third is the stability phase. The mobility phase is specifically designed to decrease spinal rigidity. And everything we're doing is to mobilize the scoliosis where we want it to mobilize to help improve flexibility of that curve, to help them respond better to the next phase of care, which would be the adjusting phase. So let's go ahead and show you some of the things that we do for mobility. This is the Wobble Chair. This Wobble Chair was developed by Dr. Burl Pettibon, and it was based upon the principle of increasing spinal flexibility. Now, why is this important for scoliosis? With scoliosis patients, we know that as the curve sets in, the spinal discs become rigid and become deformed into the shape of the scoliosis, developing a wedge-shaped disc, which will help promote and continue to develop the scoliosis. What the Wobble Chair allows us to do is to help rehydrate and remodel those discs into a better position by first warming them up. And this kind of sets us up all for our future therapy and rehab that we'll be doing in the clinic. So the wobble exercise can be performed very specifically to help increase disc flexibility, and then it can also be utilized in specific curve patterns, which we're going to see in a second. So let's go ahead and demonstrate how the Wobble Chair will actually function. Before we demonstrate the curve patterns, we want to demonstrate what the Wobble Chair can be used for general flexibility and spinal health. So first thing is we have 3 basic motions that we teach. One is called flexion extension. So this is where the patient goes through this type of motion, go ahead and extend and flex. So you can see how she goes through full extension and then full flexion. And what you can see, the chair is actually moving under her pelvis. Go a little bit quicker there. So you can see how she gets full motion into these discs. And what they're doing is helping rehydrate the discs in this specific area. And she's rolling through her entire spine. The next motion is going to be lateral flexion. So she's going to bend left and bend right. And you can see how she gets full motion. And the chair is moving under her. And it allows these discs to pivot right through the nucleus of the disc to allow better flexibility into those disc areas. And then the last one is going to be spinal rotation or twisting. And you can see as she turns that she can get through full rotation through the pelvis. Okay. And those are the 3 basic motions that we have. Now we have specific curve types that we do as well. So I want to demonstrate the S-curve pattern. The S-curve pattern is 2 movements. We'll be working on the lumbar and the thoracic curve at the apex. So we find where the apex is and we instruct the patient to use their hand as a pivot, and then they're going to flex over that curve. So go ahead and do that for me. And when they flex, they're going to use their hand to kind of push into that curve to help unwedge those discs that have occurred into the scoliosis pattern. And what this is doing is helping mobilize and warm up these disc tissues so when we perform our future therapy, we have a better response. Next, motion number 2 for an S curve is going to be the thoracic curve. And it's the same instruction, but except now where you're getting their hand really high up in their thoracic spine, arm goes up, and they flex, try to force the movement into this area here. And you can see how that thoracic curve, we get an increase or a decrease in that thoracic curve. Now, we know we are bending a little bit into the lumbar curve at this moment, but again, this is only a warm-up for our future therapy that's going to allow this to help increase the mobility of this area. This is a lumbar curve demonstration, and with the lumbar curve, we're trying to increase the flexibility of these disc tissues and try to unwedge them. So you can imagine the discs are wedged like this. We want to open up those disc tissues. So go ahead and perform the exercise, Tina. And she's going to flex towards me, and she's going to really try to open up this area and come back to neutral. Good, and really flex over. And she tries to use her hand to try to increase the force in that area and try to pivot over that. Okay. And of course, this is prescribed uniquely for that particular patient. So we want to demonstrate one for the thoracic curve, and you see her curve is up here in the thoracic, so she's using her hand to pivot off the ribs. Now remember that ribs are angled, so they don't go straight out, so we want to go off the ribs, so that's why her hand's a little bit below the apex. And again, we want to increase the flexibility of this area, so her hand will go over her head, and she will perform the wobble exercise, trying to increase flexibility in this area. Again, with every wobble, she's opening up those discs and try to unwedge them as she's wobbling through that motion. Okay. Good exercise to help warm them up for the upcoming intensive care.